Anxiety is a systemic biological overload. When your nervous system misfires, the shockwaves spread and your entire body reacts. Misinterpreting these signals as separate medical conditions, like a racing heart or chronic exhaustion, leads to a cycle of treating symptoms while the underlying nervous system remains in distress. This creates a difficult choice. You have to determine if you are dealing with a mild stress response that requires a simple lifestyle adjustment or a severe condition that requires a professional psychiatric evaluation. The manifestations of anxiety are diverse. Severe physical indicators like chest tightness and chronic digestive issues often hide the true cause of the distress. On the cognitive and emotional side, anxiety looks like severe sleep disruption or sudden, unexplained episodes of tearfulness triggered by raw hormonal stress. Your primary trade-off is between low-barrier, self-directed lifestyle changes and the significant investment of time and emotional vulnerability required for a full medical evaluation. Correctly identifying the root cause of these symptoms is the only way to avoid masking a chemical imbalance and to secure the right tier of treatment. First, we isolate physical manifestations of anxiety. Chest tightness is a common indicator, notoriously difficult to distinguish from genuine cardiac issues without professional testing. Beyond the heart, the gut-brain axis is a major site of disruption. Psychological stress physically alters how your body processes digestion. This disruption often results in acute stomach upset, persistent nausea, or diarrhea, as the body reacts physically to mental strain. One DIY intervention is adopting an anxiety-friendly diet. By removing triggers and adding specific nutrients, you can stabilize your digestion and lower baseline physical stress. Warning tone. This requires high daily discipline and planning. While it helps the gut, a diet alone cannot resolve underlying psychological trauma. Similarly, strict sleep hygiene protocols can combat anxiety-induced insomnia and reduce the daytime fatigue that makes symptoms feel worse. Optimizing your diet and sleep offers accessible relief, but these interventions function as temporary patches if a deeper clinical issue is left unaddressed. Next, we evaluate the mental and cognitive toll, the symptoms that happen inside the mind. Brain fog is a common result of anxiety. It degrades your concentration to the point where simple daily tasks feel insurmountable. This cognitive strain is often paired with unexpected emotional sensitivity. Crying for no apparent reason is a physical reaction to hormonal stress triggers. These symptoms impair your professional life. Workplace stability and performance drop. Personal relationships face collateral damage. Clear communication breaks down entirely. Many people attempt to manage this by using structured, self-taught coping strategies to power through their social and professional interactions. Masking severe symptoms requires continuous, exhausting mental effort. This constant performance of stability frequently leads to total burnout. Attempting to white-knuckle your way through brain fog and emotional volatility with willpower alone is an unsustainable strategy that degrades your quality of life. We must eventually recognize when lifestyle changes and coping mechanisms have reached their limit. Certain indicators mandate professional help: the presence of depression and severe, unrelenting physical symptoms like persistent chest pain. When anxiety and depression overlap, they create a cycle that requires specialized attention to prevent a rapid downward spiral. Crossing the clinical threshold provides a definitive diagnosis and opens the door to targeted professional therapy. The trade-offs of clinical care include financial costs, time for appointments, and the emotional vulnerability of asking for help. However, avoiding this care is a massive risk. You may accidentally ignore a genuine cardiac event or allow a treatable psychiatric condition to compound. When symptoms become frightening or emotional volatility paralyzes your routine, the cost of a clinical evaluation is outweighed by the danger of self-misdiagnosis. The level of intervention you choose must scale precisely with the frequency and severity of your symptoms. We can map the correct path forward using this evaluation framework. The Lifestyle Optimizer profile represents those dealing with occasional, situational stress. For this group, diet changes, sleep tracking, and basic coping tips are effective and have a very low barrier to entry. The intervention-ready profile represents viewers with chronic, debilitating physical or emotional symptoms. At this level of severity, the necessary trade-off is yielding control to medical professionals rather than attempting to self-treat. This involves partnering with a comprehensive medical facility, such as Arka Anugraha Hospital, for a combination of therapy, lifestyle medicine, and psychiatric care. Seeking this level of professional support offers the highest probability of long-term remission, not just a temporary pause in symptoms. Assess your own symptom checklist against this quadrant to establish an honest baseline. Stop guessing at the root cause. Match the severity of your symptoms to the correct intervention path to reclaim your physical and mental health.